Hello everybody, welcome to the EM Code. I'm Dr. Vajiha, emergency physician by occupation. Join my quest in asking right questions from right people to get right answers. Our guest for today is Dr. Rajkumar, who is heading an emergency department at a medical college, who also heads a simulation lab there. He is known for his disaster drills and the lifesaver courses and the virtual classes he holds. Welcome to the EM Code, Dr. Rajkumar. What would your advice be to the young emergency physicians who join emergency medicine and take it as a career? Like many young doctors look up to you. So, what would your advice be to them?
Emergency medicine is not something that comes to you. It's something you have to go looking for, right? Don't choose emergency medicine because it is an option, because it's not easy. You can only hang in there in emergency medicine if you search for it, if you seek it. So emergency medicine is for people who seek it. It's not for people who choose it, right? You have to actively search for it. You have to strive for it. It doesn't come as an option, and it's one of the most difficult specialties there is, right? I'd say right up there, emergency medicine, anesthesia and critical care. These are the really difficult specialties, and emergency medicine is one of the toughest. And it really takes a lot of dedication because the shifts are hard. You are constantly working different shifts. You're constantly shuffling your sleeping cycle, and yeah. So choose emergency medicine only if you seek it, and don't keep it as an option. Don't choose it because it was an option available to you. And people who are already chosen emergency medicine, people who are looking to become great EPs, don't stick to a general formula. Don't stick to one rotation or one formula. Find out something you're good at. Find out something specific in emergency medicine that you want to pursue, be it leadership, be it education, be it a specific type of emergency medicine, pediatric or geriatric, or whatever works for you. But find that one particular thing and be the best at it. That's what I will tell you. That's the best advice I can give to future emergency physicians, because it is a competitive market. It is a saturated market, right? And what makes you stand out? What makes you special? Why should people hire you? That's the question, right? So find out that thing in emergency medicine, right? Use your residency to find that one particular thing that clicks for you, that makes you better than the rest. That's what.
Not deal with the Google doctors we have these days. How do you deal with the Google doctors? Any tips?
Okay, so Google doctors, it's a very difficult task, and people who work with me in the emergency department will tell you that I'm not very good at it. So that's because each of us comes with our own preconceived prejudices, right? We're humans; we can't change that. All of us have certain amount of prejudices towards certain kind of patients. That's coming from our past experiences, right? Our past own baggages. Now, it takes a lot of human strength and mental strength to put those baggages aside and be as rational as possible in the ED. And that requires recognition of those prejudices. So, when you had a difficult conversation with the patient, when something didn't go well with the patient, I think it's important that you talk to a colleague about how that went, and you ask them what you could have done better, because your colleagues who work with you on the floor are the real judges of your character, right? Your parents cannot judge you rationally. Your juniors cannot judge you rationally, not your seniors, but your peers who work alongside you on the floor, they're the best judge of your character, and they can help you identify those little things, those little ticks that we have that we ourselves don't really recognize, take it for granted, but they really can help you build your character. And if you're not trying to improve yourself in the emergency department, then you're not in the right place. So every patient is about doing better for yourself. Every patient is about how you can do better to the patient as well. So try to have those conversations with your colleagues and friends. And my friends have helped me a lot. Right, my friends have told me where I've crossed the line, where I've overstepped, and I'm really glad that they have, and that's helped me identify those things. Whether or not I corrected those things, whether or not I've gotten better is another story altogether, which honestly I haven't, but I'm trying to. So.
This fact is accepted all over the world that emergency medicine as a specialty is very stressful. So, how do you maintain your work life balance? How do you balance your mental health? Has your mental health ever taken a back seat? What would your advice be in that case?
Really does take a toll on your personal life, especially because of the odd shifts. There are some advantages to it and there are some disadvantages to it. All of you who are practicing emergency medicine already know this, right? Which means that you on a weekday you can get your other works done because you might have a night shift on that day. So, but it really does affect your health, because there's no easy way around this. Sleep is absolutely essential, and when your sleep cycle is messed up, it really affects everything else in your system. It really messes up your normal routine lifestyle, and I found that out the hard way. I personally suffer from an autoimmune disease, and the psychosomatic aspects of emergency medicine really messed up my health, and I was in a very bad place. So, but I've come to find some amount of balance with it, because I'm now a consultant as an in charge of a department, and I have a 9 to 6 work style, which means I have more defined sleep cycles. I can go to the gym, I can work out, I can find a more healthy life balance, So that's working out well for me. But that is something you have to keep in mind always. It is really going to affect your health issues, your diet, and your working out, and your working in the ED on the floor, running around is not honestly working out. You all know that. So you really have to factor in all those things and think about whether emergency medicine is right for you. Uh, if I had gone to a rheumatologist and told them about my psychosomatic problem, my autoimmune disease, the first thing they tell me is to stay away from emergency medicine. But anyway, here I am. I couldn't stay away from emergency medicine. So I'd say you have to really take that into consideration.
Education system as whole follows certain prototype. So do you think any changes or reforms are needed that can improve the quality of education and also reduce the stress on the students? How do you think we can change that?
So changes I'd like to see in the emergency department, especially medical education wise, is I think we really need to integrate a lot more simulation based education into emergency medicine because that is the future, right? So the skill based training, your simulation based training, they really improve patient safety and the level of understanding of a student, the level of retention of medical science is much higher because there is something called a Yokes-Dodson curve, right? This particular metric, it demonstrated that when you put the students in a certain amount of pressure, when you put them under a certain amount of stress, that's when they learn to their maximum capability, right? So it's not about just teaching a class, or it's not about putting them at the patient side and then expecting them to learn. That really doesn't work. So you create an environment which simulates the stress environment in an ER, and you let them practice and learn. That really enhances retention, and that's pretty evident from science. So yeah, medical education is pretty serious stuff. Most people don't understand this. Medical education itself is a separate specialty of medicine. That's how I put it. Right? Most people don't realize this, and this is something I've come to realize recently, and I'm starting to read about it. I'm starting to delve into it more, and I find that it's a fascinating and difficult subject. And it would be great if there are structured training programs for our teachers. It would be great if our teachers don't teach at their own whims and fancies, right? It would be great if there is a way of training our teachers to teach better, and that is what is essential to ED management. I'm not saying my teachers are bad, but I'm just saying that we would be much better off with better teachers, right? A better teacher does not mean someone who has better knowledge. The knowledge aspect is already there. We have the knowledge aspect of it, but it's about delivery that is lacking to some extent. And yeah, that could really help the emergency medicine education system. And needless to say, there's a lot of controversy about recognized and unrecognized ET degrees. Irrespective of all that, we really do need teachers who are trained to teach.